Hello students, welcome back to the study portal. In today's video, we will be talk about emergency care in different kind of situations. In the previous video, we talked about what is emergency care, what are the aim of emergency care, and what are the legal considerations of emergency care. So in today's video, we will be talking about different scenarios in which emergency care is given, right? Some of the scenario we will be talking about. The first one is emergency care in bleeding. Whenever a patient comes to you with excessive bleeding, right, what are the three steps of emergency care? Pressure, elevation, rest and reassurance, PER. These are the three steps of emergency care given in bleeding. First, you have to apply the pressure with your hands onto the site, direct onto the sites of the bleeding, right? And then elevation. Elevate the area where the bleeding is happening so that the blood flow may not be continuing at that area, right? And then rest and reassurance. Make the patient rest and reassure them that nothing is going to happen, right? In the image you are able to see, first you have to apply the pressure with hands, apply dressing and press so that the dressing may soak up the blood, and then apply tourniquet, wrap, wind, secure and time. Also note the time at which the tourniquet has been applied so that the emergency caregiver may assess that how much blood the patient has lost till the time a tourniquet has been applied, right? Next scenario is emergency care in shock. See, there are basically 5 type of shocks. First one is septic shock. Septic shock occurs from infection affecting the whole body that lead to low blood pressure. It affects infants and the elderly persons with weakened immune system. Any bacteria, fungi and some viruses can cause septic shock. Whenever you are in the outside and you have some allergic reaction into your body, that is also a type of shock which is known as septic shock. Next one is anaphylactic shock. Anaphylaxis is a severe allergic reaction affecting the whole body. When reacting to allergies, the body releases histamine which causes the airway to tighten and inflammation in other body organs. Whenever you inhale some type of virus, some type of fungi, right? So what happens, your body releases histamine and it blocks your airway by causing inflammation into your airway. Why? Because the body thinks that the more bacteria will be inhaled if it not tightens your airway, right? So what will happen? Your brain will not receive any kind of oxygen and you will be transferred into the state of shock. Next is cardiogenic shock. This type of shock occurs from heart problems. Heart attack and cardiogenic shock are two different kind of things. In this case, the heart is damaged and cannot pump the blood as it should. Usually it results from heart attack, myocardial infarction and other serious heart conditions. When the heart stops pumping the blood due to heart attack or myocardial infarction, it comes under the state of cardiogenic shock. Next is hypovolemic shock. Hypovolemic shock results from excessive loss of blood and body fluids due to injury. That is when a person loses a fifth or more of their blood content. The heart cannot pump sufficient blood for the body organs. Shock is any kind of state where you cannot respond to the outside information given to you. If someone shakes you or asks you some question, you are in a state of shock. You cannot understand what is going on around your environment, right? Next is neurogenic shock. Neurogenic shock occurs from damage to nervous system. It is common with spinal cord injuries from accidents and other form of injuries, right? So these are the 5 types of shock. And whenever you are assisting some patient who is in shock, who is not responding to your impulses, right, what will you do? You will first elevate the patient's leg. What is the basic science behind elevating a patient's leg? Is that more blood will be flowed to the brain, right? Because when a patient comes to the emergency department, sometimes what happens, no one knows why the patient is in the condition of shock. When you assess the vitals of the patient, when you check each and every organ of the patient, then you come to know that what is the main reason behind the shock. But till then you don't know the reason of shock, you just know that the patient is in the state of shock because it is not reacting to any kind of impulses. He is in his own world, right? What will you do? You will elevate the patient's leg so that more blood flow is flowing towards the brain, right? And then the brain has enough nutrients and oxygen to act, right? Next condition is emergency care in burns. Basically what happens, if the burn is first degree or second degree, the first aid is done inside the home only, or at the area where the patient has been suffering from burn. But if a patient comes to you, what will you do? You will cool it with cold running water for 20 minutes. The site of the area where the burn is done, when the patient is suffering from burn, you will cool that area with cold running water for at least 20 minutes. And you should remove the jewelry because it may constrict the area as it swells. And what will happen if the swelling becomes excessive, and then the jewelry will be stuck at this place only? What will happen? Blood supply will not be given to that area, right? Once cool, lay kitchen film lengthways over the burn, not around the limb in case of swelling. Alternatively, place a clean plastic bag over a foot or hand. You should put a cool kitchen film, thin film, thin type of film, plastic type of film is called the kitchen film. You should place that at the area of the burn, right? If you do not have these, use a sterile or clean non-fluffy dressing to place over the burn, but it should be cool. And then if you suspect that the burn is very excessive, you should fastly seek medical advice, right? In case of severe burn, if the burn is greater than 10 degrees, 10 degree of the body, 10% of the body, what will you do? You will immediately call the emergency medical service. And when the patient comes to your emergency medical service, your emergency department, you will follow these 4 steps, like running the cold water for 20 minutes, removing jewelry, applying a thin plastic bag over foot or hand, or use a sterile clean or non-fluffy dressing. What you should not do is directly apply ice to the area of burn, or you should not burst the blisters, right? Or you should not apply any kind of dressing that may stick to the area where the burn is done. And you should not remove clothing that is stuck to the area, to the skin. And you should also not apply any kind of lotion or creams. If the patient comes to you that he has applied ice or burst the blisters, then further medical care should be given to the patient, right? Next is emergency care in choking. Whenever a patient comes to you, or if the patient is in the medical department and there he inhales something or there he swallows something, right? And the patient ends up in the state of choking, what will you do? You will encourage the patient to cough it out, right? You will encourage the person to keep coughing. If that also does not help, you will give 5 sharp blows between the shoulder blades and check their mouth that what is happening, right? If the airway is struck or not. Or you should squeeze it out by giving the abdominal thrusts, right? Next scenario is emergency care in poisoning. If the patient has been bitten by any kind of insect or any kind of reptiles or snake, etc., what will you do? Poisoning can occur in 4 ways, that is ingestion, swallowing a poison, inhalation, breathing some poisonous gas, or breathing carbon monoxide, etc., absorption through skin, or injection like needles, bites, or stings, right? If the patient is unconscious, you should contact poison information center. Or if the patient is conscious, you should apply DRABC. What is DRABC? You should check the danger, that if the danger is present around the patient, you should check for responsiveness of the patient. DRABC: danger, responsive, response, airway, breathing, and circulation. You should check the area around which the patient is there. Is there any area where is there any danger present at the area? You should check responsiveness of the patient, if the patient is responding to your impulses, responding to your speech, etc. or not. You should check the airway of the person. If the patient is unconscious, you should check if the airway is blocked or not. You should check the breathing for at least 10 seconds, if the patient is breathing normally or not. And you should check for circulation. You should check pulse of the patient, if the patient's pulse is working or not, right? And what will you do? At the site of insect's bite, poisonous insect bite, what will you do? Above 3 inches, you will apply a tight bandage, right? You will immobilize the patient, immobilize the site by stopping any kind of blood flow from that area. And you should not apply the tight bandage below the insect bite. You should always apply the tight bandage above 3 inches above the bite, right? So that the poisonous blood does not flows towards the heart. Okay, if the poison is from insect bites or stings, apply ice, apply pit immediately. What is a pit? Pressure immobilizing technique. This is a pit, right? Apply pit immediately if allergic reaction occurs, or if casualty is known to be allergic, so that the blood may not flow towards the heart, right? Marine stingers, the stingers present in the water. Place hot water for scorpion or stonefish stings, or place cold packs for jellyfish or blue bottle stings, right? Next up is emergency care in asthma. If the patient is having asthma attack, how will you make sure, how will you assess that the patient is suffering from asthma attack? If the patient is rapidly breathing, patient is suffering from shortness of breath, or patient is holding his chest and complaining of chest tightness, and the patient is wheezing to inhale air, and the patient is having racing heartbeat. If the patient is having more than 2 of these factors, you will automatically guess that the patient is suffering from asthma attack, right? And if the patient is known to be asthmatic and he is suffering from asthma attack, then there should be a inhaler presented with the patient. Or if the inhaler is not present, you should go check for an inhaler and give the patient the inhaler. What will you do if the patient is suffering from asthma attack? First, you will assess if the patient is suffering from chest tightness, patient is wheezing, speechless and gasping for air, right? Make sure the patient sits upright, stay with them, treat 1 puff 6 breaths, repeat 6 times when possible. Use a spacer, the inhaler, right? Give 1 puff of the inhaler and 6 breaths to the patient, so that so that there is enough oxygen into his body. If no improvement occurs, call emergency, call treatment, and continue treatment every 6 minutes. Call the emergency, call the code inside the hospital. Keep monitoring the patient after 6 minutes, or continue the treatment of giving 1 puff and 6 breaths. Ensure symptom free, repeat treatment and rest, or repeat the treatment and rest. Make sure the patient rests. These are the some cases in which emergency care is given. There are more such scenarios like emergency care in seizures, emergency care in fractures, right? That we will study in next part. Thank you so much.